Jackie Andrade. I'm Professor of Psychology. The research we did was a national, in fact, international project on accidental awareness during general anaesthesia. So across the UK and Ireland, we asked local coordinators in every NHS hospital to report any cases where patients had said that they'd been awake during their anaesthetic and weren't expecting to be. The important outcomes in terms of impact were that we confirmed that accidental awareness has really serious psychological impacts with people experiencing symptoms of trauma for many months or even years afterwards. We also found that the likelihood of this happening was strongly related to patients receiving the drugs that are often used to paralyse them during an operation. So these drugs are muscle relaxants that help the surgeon, but they don't have any impact on consciousness. And another thing that we found was that sometimes these drugs take a while to wear off after the anaesthetic has been stopped, and that some patients interpreted that residual paralysis as an episode of awareness. So that's one of the things that's had an impact, is that there are now new guidelines telling anaesthetists they must check that paralysis has worn off before they stop the anaesthetic to prevent this type of awareness. And we published a psychological pathway explaining how anaesthetists or the whole medical team should support patients who report awareness, starting with, acknowledging what happened to them, giving an explanation if possible, and then checking in so they can be referred to specialist psychological support if they need it. So much of the impact has been about new guidelines published by the Association of Anaesthetists and the Royal College of Anaesthetists that incorporate these findings, explain the risk of awareness differently to patients in the patient-facing leaflets, and also the evidence incorporated into the exams that trainee anaesthetists have to take as part of their professional qualification.